Hi, I'm Susan Buckingham, and I'm going to be introducing conduct disorder. Conduct disorder comes on at the childhood. Its onset creates aggressive behavior in the child. Um, According to the DSM, it's brought on generally by the lack of attachment, or it's brought in by neglect or abuse. It can be brought on in early adolescence. An adolescent will start experiencing problems at school, suspensions, being expelled for aggressive behavior. Contact disorder children generally have a lack of empathy and sympathy for their siblings and their peers alike. Today we're going to be visiting with Mrs. Smith. Ms. Smith is an ongoing client, and her child has been experiencing a conduct disorder since an early age. She and her husband divorced and found out that the child had been being abused. And so Claire has been experiencing some conduct disorder, and her grades and activities at school have suffered. So without further ado, we'll bring in Mrs. Smith. Hi, Mrs. Smith. It's good to see you
Hi,
again.
nice to see you too.
So we're here to talk about Claire again. I know that she's been acting out at school. I got that message from you. So kind of want to talk about a little bit about what's going on in her life and since the last time we talked.
Well, there's been a lot of changes at home because my older daughter just moved out and went to college.
Okay.
And I think that probably triggered some of the new behaviors that we're seeing. She's been very angry, and recently when I went out to the grocery store, I came home and she had set fire to our cat, which of course was awful. Cat will be okay, but also she broke all the windows in her room and obviously was pretty upset about it, whatever was going on inside of her. But then when I asked her about it, she just didn't really care that she had hurt the cat and destroyed our property.
Had she ever had this kind of behavior before?
Not to this extreme.
Okay.
Not to this extreme.
Okay.
She's shown a lot of anger, but not specifically in this manner.
Okay. And this, when your daughter moved out and went to college, have you guys been spending a lot of time together?
Yeah, we've been able to do some really nice things just one-on-one. Go to the movies and go out to dinner so that we can have time to talk. And, you know, I've been telling her all the wonderful things she's doing, but she just doesn't really seem to care anymore.
Okay. Any problems at school?
She's not getting along very well with her peers. Seems pretty angry with them and finds a lot of fault in their behavior and says really cruel things to them. I've had a conference with her teacher, and all these things were brought to my attention.
Okay. All right. Well, let's bring in Claire
Okay.
and see if Claire can share a little light on what's going on in her life.
Great.
Claire, you want to come on in? So, hi. How are you doing?
I'm great.
Are you?
Yeah, just fine.
So, your mom was just describing a situation where she had left the house, had gone to the grocery store, and you showed some aggressive behaviors towards your cat. Now, this is the cat that you really wanted, right? That mom got you?
I don't really care.
You know? Okay. Yeah. So did the cat cry when you set him on fire?
Maybe. I don't really remember. Didn't really care.
You didn't care. Okay. So you didn't feel like the cat was hurting, and you didn't feel any sense of need to comfort the cat, or
No.
no? Okay. All right. This is very typical behavior of conduct disorder. The child doesn't have any sympathy, doesn't seem to acknowledge the pain and the agony of someone else, or in this case, the cat that she'd gotten that her mother had given her as a therapy cat. So this is very typical of the behavior of conduct disorder. They don't acknowledge that there was an experience here that they could have comforted or acknowledge that someone else or something is suffering. Thank you so much.